this is Ashley Old, Case Manager with Bright Futures Families. With today's Ask Question, what procedures are involved in the medical screening process? The medical screening process in a surrogacy journey is a very thorough and important step. Its goal is to make sure that a potential surrogate is medically, physically, and emotionally prepared for a healthy and successful journey. While the exact requirements can vary slightly depending on the clinic, most screenings follow a very similar structure. It typically starts with a comprehensive physical exam, similar to an annual exam. You might have already felt very familiar with that. This is also very common to have an updated pap smear during this time, especially if your last one was a bit ago. This ensures everything is normal from that gynecological standpoint. This may also seem like a duplication since during the initial screening process with Bright Futures Families, we do require that yearly exam, pap smear, and form signed by your OB. However, the RE is verifying everything. From there, you'll complete a psychological evaluation. This usually involves a conversation with a licensed medical health professional and a standard assessment like the PAI. This step is really about making sure you feel supported, understand the journey ahead, and are emotionally ready for the unique aspects of surrogacy. This may be done with the clinic or by any outside provider. Next, there are several imaging procedures. A baseline ultrasound is done to look at the uterus and ovaries, and a Doppler readings may be used to evaluate blood flow. A hysteroscopy or an SIS, the saline-infused sonogram, is also performed. These allow the doctors to get a very clear view of the inside of the uterus to ensure for optimal environment for a surrogacy pregnancy. You'll also complete lab work, which includes a variety of blood tests. These check things like hormone levels, infectious disease, sexually transmitted diseases, and your overall health. A thyroid panel is often included since thyroid function plays an important part in pregnancy. Additionally, a drug screen is required as part of this standard medical clearance as well. All of these steps work together to create a full picture of health and readiness for surrogacy. It may sound like a lot, but each part is designed to protect both you and the intended parents and to give everyone the best possible chance for a smooth and successful journey. Many of these items are required to be done at the intended parent's clinic. Sometimes, though, all these pieces can be done locally to the surrogate. If you have any more questions, we would absolutely love to hear from you. Just visit our website at www.brightff.com and to reach out and to submit any of your questions. Thanks.